Hello, this is Amber Fee, a reimbursement specialist with the NIH SEED Office, or Small Business Education and Entrepreneurial Development Office. Today, I am going to present the second webinar on medical codes. During this webinar, we will talk about finding an existing or requesting a new code. This webinar will discuss finding the right medical billing code for your product, and if there is no code in existence for your product, we will discuss how you would request a new code. So our learning objectives are to understand where and how to find medical device codes and to gain familiarity with how to request a new CPT or HCPCS code. Medical billing codes are how you get paid. So medical coding is an integral part of any innovator's reimbursement strategy. Finding the right code for your device or requesting a new code if needed is essential. So the information about how to find a code and requesting a new code if it is needed is essential to you. Just a quick refresher from our last webinar. CPT codes are for services. CPT codes are 5-digit numeric codes that are used to report medical services from qualified healthcare professionals. Think licensed professionals that may submit claims. These include medical, surgical, and diagnostic services. CPT codes are maintained by the American Medical Association and are used universally by both government and private payers. HCPCS codes are codes that we generally think of for items such as durable medical equipment. Think walkers, canes, bedside commodes. These are items that are utilized in the home. There are pharmaceuticals that are described by HCPCS codes and ambulance services that are described by HCPCS codes. HCPCS codes are maintained by the Centers for Medicare and Medicaid Services and are used universally by private and government payers. ICD-10 codes are diagnostic codes. We are not going to discuss them during this webinar, but we will discuss them in a later webinar. Let's talk about some instances to consider whether or not you actually need a HCPCS code or whether there is likely a HCPCS code for your item. HCPCS codes apply to durable medical equipment that is utilized in the home. If a device will be used in an inpatient or outpatient setting, it is likely that it does not need a separate code because it is owned by the facility. These devices would likely be considered part and parcel to the service that is being performed. Let's look at a few examples. Let's look at an example, and a patient has had ankle surgery and a metal plate has been attached to the ankle with a new type of screw. The screws that are used in the surgery cannot be billed separately. They are considered part and parcel to the surgery, so there is no separate code for the screws that are utilized in the surgery. Example number 2, if there is a device used in the inpatient hospital setting, such as an infusion pump that is dispensing pain medication, it would be owned by the hospital and it would be covered under room and board and would not have a separate billing code. And under example number 3, if a device is used in an outpatient setting, such as a scoliometer in an orthopedic practice, it would be owned by the orthopod or by the practice, and it would be covered as part of the patient visit and not billed separately. So how will you know if there is a CPT code or HCPCS code that describes your product or device? You can start by looking online, by typing in descriptions of your product or service or device, and see if there is a CPT code or a HCPCS code that comes back to you, or a couple CPT codes or HCPCS codes that come back to you. The problem with this is that you may not receive a complete list. The definitive source for all CPT codes and HCPCS codes, and the best source, is probably the CPT and HCPCS code books for the year that you are looking. You could possibly go to the CMS website and download all of the addendums and have a complete HCPCS code set. That's going to be a tough thing to do. Much easier to pick up the CPT code book or the HCPCS code book. Okay, you can also research similar medical products that have already been assigned a code. If similar medical products exist and they describe exactly what your product does, those codes can be utilized for your product. It is probably an easier road if a similar code or product already exists out there and you can utilize that code. However, if it does not describe your product, do not utilize the code and go down the road of obtaining a new code. You can use a reimbursement consult to help research and request a new code. If you have found a code that is utilized by similar devices, but your device is different from existing products or serves a different purpose, you may need to apply for a new code or apply to revise an existing code. When applying for a new code or a code revision, you will explain in detail why existing codes are not applicable to your device. There's a caution here that I mentioned in the last slide as well, but using a code that almost fits is not a good idea because using an existing code that is not fully applicable could result in an audit for possible misrepresentation of the service, which could result in recoupment of payment. It could also result in designation as a fraudulent claim and denial of reimbursement. Something else to consider in your reimbursement road, different payers have different payment policies. Be aware that just because CMS or the American Medical Association has assigned a billing code to a product, this does not guarantee payment. Payers reimburse for medical products and services that are contractually covered or required by law. You will find coverage information and coverage determinations in their payment policies. Government payers such as Medicare, state Medicaid agencies have specific payment policies. Many are defined in statute, which are described further in local or national coverage determinations and coverage articles. If there is a Medicare Advantage plan, the plan also has coverage determinations or payment policies that you must pay attention to. It is possible that you can negotiate with the Medicare Advantage plans for coverage if you have a new code for payment. Less likely that you can negotiate with the contractors, the Medicare contractors in fee-for-service, but not impossible. More likely that you can negotiate with the private payers because they have more leeway in determining what is or is not covered. A device that produces a better outcome, prevents the need for additional treatment, may be approved for reimbursement by a private payer, but may in fact not be reimbursed by a government payer, particularly if it is sort of a preventative device. If you are going down the road of applying for a new or revised CPT code, you can apply to the American Medical Association's CPT editorial panel. You can apply to add a new code or revise an existing code. In 2023, the AMA added 230 new CPT codes, revised 70 codes, and deleted 49 codes. This is why it is very important to make certain that you are looking at the current year's codes to assure that there is no code that describes your product or service. Applying for a new code or applying to revise an existing code requires quite a lot of information. It will require a detailed request with documented evidence of the need. The evidence should include a literature review, clinician testimonials, clinical data, and more. It is quite time-consuming, but probably worth it if you are assigned the code in the end. On the left here, you will see a QR code that will link you to the American Medical Association site where you can apply for the CPT code. Applying for a new or revised HCPCS code is similar to the CPT code, except that you will be applying to the Centers for Medicare and Medicaid Services. Here you can apply for two types of codes. They are to add a new code or revise an existing code. In 2023, CMS added 345 new HCPCS codes and discontinued 74 codes. They made many changes in description, coverage, and payment to existing codes. Similar to CPT codes, the HCPCS request application should include thorough, documented evidence, clinician testimonials, and all other required application information. On the left, you see a QR code that will link you to the MIRIS electronic request information system, and that is where you will find all of the information about applying for a HCPCS code. You will have to create a username and password in order to get into the system, and it will provide all of the information and links to applying for a HCPCS code. Policies for digital and remote monitoring devices, digital apps. CMS does not currently allow for the reimbursement of digital apps. It is certainly an area that is growing. There is evolving policy and regulation, so you should watch this closely if you are the innovator of a digital app. Note that private payers may reimburse a digital app even when CMS doesn't if it improves patient outcome, or they can find a benefit to them for reimbursement of the app. Remote patient monitoring is a form of telehealth and has 5 primary CPT codes. RPM collects physiological data. It may be that you have an app that collects physiological data and communicates with the physician, and so the physician may be able to bill for remote physiologic monitoring. It may be then that the app is considered paid for under the remote physiologic monitoring codes. There are also remote therapeutic monitoring codes, and the same rules would apply there. Some key takeaways from our webinar today. Innovators should research CPT or HCPCS codes thoroughly and see if there are any that could potentially apply to their medical product. If a CPT code or HCPCS code does not exist, you have 2 options. You can apply for a new code or apply to revise an existing code. Using a code that is close but not fully applicable is not advisable because it could trigger an audit. It could be designated as a fraudulent claim, or it could be denied reimbursement or involve recoupment of funds that have been paid. Having an applicable code for a new product does not guarantee reimbursement or payment from a payer. Thank you for listening to the webinar today. On the left-hand side, you will see a number of ways that you can connect with SEED, and on the right-hand side, you will see various ways that you can sign up for NIH and SEED updates, and you can sign up for the NIH Guide for Grants and Contracts.